Well, we heard a great amount on malaria, and then with the helminth infection. So I would like to reorient the group back to vector-borne diseases. Within that, I'm not going to cover malaria, though I started my work on malaria. And around 2011, with a EU-funded project in a dengue consortium, I started working on dengue, and it took off from there, going more deeper into Aedes-borne diseases, and kind of just keeping me busy since then. But going back to malaria with Jane in India, so I'm completely excited about that. But I would like to give a little bit of a broad overview. We heard a lot about malaria, but I would like to say a little bit more about vector-borne diseases in general. Every year, more than 1 billion people are infected, and vector-borne diseases cause approximately 1 million deaths worldwide. And in addition to deaths, of course, deaths do get our attention, but many vector-borne diseases, like we have seen in the previous speakers' pictures, lymphatic filariasis and onchocerciasis, they basically cause a lot of morbidity and disability that spans over lifetime, and so these diseases actually contribute to a much larger significant burden of disease. And here on the map, this is from a publication where you can see basically the joint distribution of these most important 6 major vector-borne diseases. And the main takeaway from this is that more than 80% of the population is at risk from at least one vector-borne disease, and more than half at risk from 2 or more diseases. So it's individually these diseases are important, but collectively, as you can see from this figure also, that they focus on the tropical and subtropical areas of the world, affecting predominantly poor populations and putting a brake on socioeconomic basically development in these regions through the burden that they impose on health systems and populations. So, and I'd like to a little bit more concentrate my talk towards neglected tropical diseases. That's a category of diseases, of course, that has been incredibly neglected. When I was a task force associate for the Millennium Development Goals and working on the Malaria Task Force report, we didn't talk about this, but simultaneously we launched a bunch of initiatives on neglected tropical diseases. We actually looked at this publication that I present here is to discuss around whether dengue is still a neglected tropical disease or not. So that was a kind of a thought experiment among dengue researchers that we put out this piece. But at the same time, we managed to review all the definitions of neglected tropical diseases out there by several agencies and try to look at the funding streams into research and development of different technologies for these diseases. And what we have seen collectively across the volume of information out there, most of these diseases are poverty related. Of course, it's an issue of access to treatment and care services, and endemic to the tropics and subtropics. They usually are associated with high morbidity but low mortality, which explains the lack of public health attention to them. Most of them, including dengue, a very prevalent disease, do not have any specific treatment available, and forget about, in most cases, for a vaccine except the yellow fever. But we have seen also with the kind of political will diminishing, yellow fever becoming less of an issue, resources for vaccine distribution, and a comeback of yellow fever in certain places. So it just really tells you about these very complex dynamics that can, these diseases may have in the policy environment. And mostly they are associated with poor research funding and shortcomings in research and development. And the public-private partnerships helped a lot. Some countries like Brazil, China, suffering from some of those diseases, kind of revamped their funding streams into development of vaccines. And dengue, definitely, of all those diseases, is one of the beneficiaries of this trend. However, you can basically categorize these neglected tropical diseases, or these characteristics are shared across these diseases. So let me just walk through some of the statistics. Vector-borne diseases account for about 17% of the estimated global burden of communicable diseases. So it's a large part, and as I said, it leads to 1 million deaths. The ones that are highlighted in bold are the 9 neglected tropical diseases that involve vector transmission. These diseases jointly cause around 600 million cases, as I said, mainly in poor populations. Dengue, chikungunya, leishmaniasis, LF, African trypanosomiasis, Chagas disease, onco, and schisto are among those diseases with large caseloads. Among these diseases that are transmitted by mosquitoes, Aedes transmitted diseases, of course, after malaria, are emphasized. But malaria is not a neglected tropical disease. So among neglected tropical diseases, dengue and chikungunya are at the forefront in terms of attention because of their burden. So the previous speakers have noted, we have had an incredible progress in reducing the burden of infectious disease, the burden of vector-borne diseases, including several neglected tropical diseases. And these reductions basically through poverty alleviation and socioeconomic development, specifically improved hygiene and sanitation practices, increased access to services, health services, and advances in the case of malaria in medical care and treatment, large-scale and more coordinated control programs, and the deployment of more effective intervention tools, particularly in the case of malaria. So as a result, the proportional contribution of vector-borne diseases to global disease burden has been decreasing. However, some diseases like malaria, even though they're decreasing at the global scale, they're kind of stable or increasing because of, as Jane alluded to, increasing drug resistance and other problems that we are having with interventions. So, but not all vector-borne diseases are really decreasing. We are seeing this staggering statistic around malaria, where the incidence has basically exploded in the past 2 decades. For dengue, human mobility, climate suitability, and urbanization are the contenders in terms of being key factors for this upsurge. So here's the most important thing, and some of the talks have already emphasized this. These gains can be greatly at risk because vector-borne diseases are dynamic problems. They're recurring problems. They don't necessarily go away. We have the vector, we have the pathogen. As we said, risk of introduction, even after elimination, is a possibility. So insecticides and drug resistance in the case of malaria, maintaining political will and resources once the disease incidence has been lower, and the potential for spread and reemergence of diseases basically threaten for some of these diseases coming back with vengeance, with higher impacts, and again, in the case of malaria, due to lost immunity. So we can't necessarily drop the ball on vector-borne diseases, and in summary, their important cause of death, disease burden, and inequity. They put a break on socioeconomic development. It's a huge strain, especially during epidemics, on health services. So continued progress is basically an important contribution to global health, global development, and global security. But one of the important challenges is, I just didn't want to say it because I think this report by WHO and WMO made very clear and nicely and succinctly, one of the important challenges for control of infectious diseases is to understand and, where possible, predict their distribution in time and space to allow control programs to target interventions and to anticipate and prevent epidemics. So this is easier said than done. There is an incredible amount of research that goes into understanding the various effects, as we have seen climatic effects or non-climatic effects on disease transmission and incidence, and as well as we are trying to get a hold of this potential spread, because timeliness of actions, basically in the face of outbreaks, is extremely critical for how to basically the entire outbreak is going to play out. So from this point on in my talk, I'm going to focus a lot more on Aedes-borne diseases and some of our work, dengue and chikungunya in different parts of the world as examples of emerging and re-emerging diseases. So this is again from that WHO-WMO report. They did a very good job of putting climatic and non-climatic factors into place. Clearly, vector-borne diseases are strongly influenced by climate and weather, and but it is, and here it is represented, temperature and precipitation basically affect vector ecology, vector density, and these together affect dengue transmission. Some of the talks, for instance, it was a good illustration of immunity and the variability in immunity, how clinical disease necessarily play out under the stress of climatic and non-climatic vectors and individuals. So it's an incredibly complex system, as you can see. Here you've got the climatic factors through the vector directly affecting, but also non-climatic factors indirectly affecting the vector and as well as the transmission dynamics. So it's very important to understand the relationships here of the climate effects, but it also how affects physical and human systems, physical environment and human systems, and how those indirect effects come into play to determine disease transmission. So environmental and social factors are important in the sense that they may reinforce climatic effects or they may counteract climatic effects. So there are also incredibly strong and important feedback loops in the system. So for instance, one example where climatic effects may reinforce social and economic factors may reinforce climatic effects is that just think about the risk of introduction into Europe with increased climate sensitivity or increased climate suitability with traveling of viremic patients basically into non-endemic populations, and the vectors are there, and these small-scale outbreaks, as we have seen in Madeira, in Portugal, and more recently in 2017 in Italy and in France. Where effects counteract the social and economic factors, counteract climatic effects, is you see with urbanization and malaria going down just because of this complex interplay on vector ecology over here. So it's a very complex system. That's what I wanted to basically highlight here. And through this, we try to understand these strong relationships and associations. And in that case, I'd like to focus on a body of work that we have been engaged. And I have to quickly say that I'm a health economist and policy analyst, but this kind of work really requires strong interdisciplinary and multidisciplinary research. I'm very fortunate to be part of a team where we are trying to disentangle some of these effects. And as I said, the focus is understanding disease transmission patterns in the short and long-term scales, and incorporate this understanding into economic models to be able to actually work with the resource allocation decisions on the ground to the extent that we get to apply these research outputs in decision making. But this is one of the work that is done with one of our PhD students in Sri Lanka. I've been working in Sri Lanka since 2011 with very strong relationship with the Ministry of Health there and advising several PhD students. And Prasad has done this terrific work where in Kalatura district in Sri Lanka, where he's actually the regional epidemiologist and looking after the surveillance system over there. So you could see that what we try to do here is using rainfall and temperature and the Oceanic Nino Index, or ONI. We try to understand the strong association of rainfall, temperature, and ONI with dengue incidence. Because it starts with actually knowing these relationships, how strong they are, and we also try to understand these variables as predictors of an upcoming change, basically in dengue incidence. So through the modeling, we have seen that increasing weekly cumulative rainfall about 50 milliliters per week was strongly associated with increased risk starting for a lag of 6 weeks. So if you see this kind of rainfall, you can expect that in 6 weeks you're gonna see increased risk of dengue. And the strongest association we found around 6 to 10 weeks following rays of more than 300 millimeters per week. This is really wet conditions, which this district and most of Sri Lanka actually has, especially when it is exaggerated by a Nino event or over the monsoons. And also we looked at the association with temperature and over 30 degrees, steadily increasing temperature, a quicker effect, a lag of 4 weeks that would give us to be able to predict an increase in dengue risk. And Oceanic Index, actually, it's interesting, it gave us a longer lag period of 6 months, so any increase over 0.5, around 6 weeks, you can see this dramatic impact on dengue incidence or expected dengue incidence. So it's actually better than temperature and rainfall because it gives us a little bit more time to act on it. And of course, the issue is whether you can have the dengue control program to act on it on those kind of measures. But here I'd like to note that we try to disentangle these effects individually. Obviously, studies are needed to look at rainfall, temperature, and ONI all together, right? And to be able to come up with some indices that can be used as an early warning variable. But this is our start. This was paper 1 in a PhD work, basically. All right, so I think global mobility, human mobility, as a driver or infectious disease spread and introduction, no need to necessarily say that it's an important factor to this audience. We have been thinking about how to come up with mobility proxies, how to take human population movements into consideration in disease spread, understanding the patterns of an outbreak spread, for instance, in a geographic location. And at the same time, we are trying to understand how we can get to those mobility proxies, what kind of data is out there. So, phone data has been, mobile phone data has been one of the sources to be able to estimate it. And now we are in the era of big data. We've refrained to saying that we are doing big data analytics, but we are using voluminous data to be able to estimate proxies of human mobility. And we applied this in Yogya in a very dense urban area. And our study area was 45 neighborhoods. So we actually downloaded the Twitter data. And of course, it has its own problems. Whether Twitter users are a good reflective, sample of the entire population over there and the movement patterns. But there is incredible work going on to be able to validate these systems. We are kind of a little bit on the users of this new novel sources of data to be able to eliminate proxies. Here you see how the villages are basically connected to one another, where people are moving in terms of a frequency scale over there. And then we developed a new index to quantify the level of exposure to the dengue virus in any neighborhood by weighing the incidence of data. So we're using the traditional surveillance data in other neighborhoods by the mobility proxies that we have developed. And then we went ahead and tried to understand whether this new index actually gives us strong association with the dengue risk in a neighborhood. And what we have seen is that our index actually was a better predictive predictor of the dengue risk than the traditional, just by looking at the surveillance data. And we also combined our index with the traditional measure, and we increase our predictive ability, meaning that these indexes are actually contributing different types of knowledge and increasing the strength of the association. So this is from Yogya, and where we are trying to this time focus on zoom in on human mobility and use of traditional data sources. There's no temperature, there's no rainfall in here, which this model can also be improved upon. All right, so this is the Chikungunya outbreak, which kind of gave us sleepless nights in the summer of 2017. We joined the forces with European CDC to do this work. They had an incredible amount of work to understand risk of introduction into Europe from Aedes-borne active transmission areas, and they were using air passenger volume data, and they had statistical models that they developed that that showed that passenger volumes are actually strongly associated with the importation risk. So we worked with them to confirm that in Var region in France and in the Lazio region in Italy, the importation of Chikungunya virus. But we didn't want to stop there, and we wanted to understand the potential spread once it arrived in these regions and where they would go. So this is our modeling work as the epidemic actually, or outbreak, sorry, started spreading in this region. This is the output of our model where we combined short rate dispersion, again using geocoded Twitter data, and we also managed to look at the flight data, domestic flight data over here within Europe to cross-check our results. And then we derived these risk maps for Chikungunya spread by combining vectoral capacity and these mobility proximity estimates. What happened is that one interesting and exciting moment is that towards the end of September, where we were all exhausted, our model was showing that it's going to go to Calabria. And at that time, no cases were reported. Our model was saying that, and also it was saying that it may go here and here, but Calabria actually had 9 cases after that. So this is again another way of trying to understand where importations can happen and how widely it would spread. And again, the importance of human mobility in driving, in this case, in non-naive populations, where though the vector is completely established, right? I mean, you can find Aedes mosquitoes, the eggs have been found in England, as north as in England. So we are projecting that Aedes aegypti is prevalent and albopictus is gonna increase its range also in Europe. All right, so the last
the last one?
Yeah, I think so. I have one summary slide or something like that. So this is the work again. I just wanted to combine everything that we are doing. This is a lot about climate effects, climate variability in the shorter term with El Nino, but our group is also working with the basically the scenarios driven by greenhouse emissions, and you can see here the output of 5 global circulation models, and on the y-axis over here the infestation area as a percentage in Europe, and you can see the trend of vector infestation in Europe under these scenarios. This is a low emission scenario, and this is a high emission scenario, and you can see that how the risk is increasing in Europe. So my final thoughts on this, after showing all this, small exemplary studies, climate affects the geographical and temporal distribution of vectors and vector-borne diseases, but these effects are mediated by many other non-climatic factors. So just looking at climate and how it is, maybe on the vector, it's a good idea to understand climate suitability for transmission. However, disease risk in a population is a much more complex prediction than just looking at the scenarios. Data on biological, environmental, social, behavioral, and health system level factors need to be incorporated into these models to be able to predict disease risk in an at-risk population in a dynamic climate. Now, where we are at, we produce a lot of research outputs, but testing of these tools and integration into decision support as part of surveillance and monitoring to assess vulnerability, to be prepared, and to target interventions, not necessarily appropriately, but cost effectively, we need these models to be more integrated. So there is a clear need for interdisciplinary collaboration in science. So our team keeps growing, and now we are working with climate health services, meteorologists, to be able to get a better handle on these environmental factors. We work with people who could actually do the spatial analysis, where we are kind of a little bit stronger on the temporal analysis. So it's a multidisciplinary challenge, and again, goes back to saying that this college is a perfect place to also kind of nurture that kind of research. But I'll stop here and get us started on the panel.
Thank you. So we'll have the panel.